Okay, it's 6:01 and we want to keep this on time. We promise we'll keep you here for just about an hour and we're going to wrap up right around 7. So I'd like to welcome everyone to our Ask the Pediatrician Forum tonight, a live Q&A session with 4 of our esteemed pediatricians from PediaTrust. My name is Ruben Rucoba. I'm the Director of Medical Services at PediaTrust. And joining me tonight are 4 pediatricians, as I mentioned. I'd like each one of them, as I introduce you, to give a little wave so we can put a name to a face. So on our panel tonight, we have Dr. Kim Forsey from Fairview Pediatrics in Grays Lake. Also, we have Dr. Susan Sirota, one of the founding members of PediaTrust and our current chair of the board. She sees patients at Pediatric Partners with offices in Highland Park and Vernon Hills. Also tonight we have Dr. Riley Minster, who is from Lakeshore Pediatrics with offices in Libertyville, Barrington, and Lake Forest, and Dr. Peter Liber from Wheaton Pediatrics with offices in Wheaton and Batavia. We have several questions that have been sent in by parents over the last few weeks, and so we're going to be addressing most of those. But as you can see on the Zoom call, there is a chat function down below, and you can enter in a question if you'd like it to be answered. We'll do our best to try and get to some of those, but again, we do have a time limit, so we are going to try and wrap up around 7 o'clock. Most of the questions that have come in over the last couple of weeks have been focused on the current COVID pandemic. So much of tonight's session will be devoted to those issues, but there will be a few general pediatric questions that we'll get to towards the end of the presentation tonight. So starting off, our first question relates to what's happening literally this week. The state, as of Friday, is going to phase 3, at least our section of the state will be going to phase 3. And we've had a lot of questions about what this means for the summer, for even the fall, for the coming months. We are lucky to have a national expert on child health as part of our panel today. Dr. Sirota was recently quoted in the New York Times article on how the pandemic has been affecting children and pediatricians' offices in particular. And she's spoken at several webinars and forums for both pediatricians and for parents and families over the last several months about the epidemic. So I'd like to direct this first set of questions to Dr. Sirota. And we had a lot of questions about what loosening these restrictions will mean for our children, for our families. A lot of questions that have to do with things like, should I send my child back to daycare? What about school in the fall? Is that safe for kids? Can my kid go to summer camp, summer sleepaway camp? And I'd like to have Dr. Sirota address some of those concerns. Sue?
Sure, thank you for the opportunity to answer that. So as you said, we're going to be moving into phase 3 and hopefully we'll be able to stay there. But reopening really depends on where we live, and these decisions are going to be made not just at the state level, but probably at the local level too, in most cases, as far as what can happen, what can open. There really needs to be a continued decrease in the cases of COVID-19 in order for programs to reopen and then to stay there. If there's an increase, of course, we could, hopefully not, but have to go back to phase 2. So really, regardless of what programs we're talking about, whether it's daycare, whether it's a summer camp, whether it's some sort of summer youth sports, or even looking ahead to school in the fall, regardless of the program, it is going to look different to your child than the last time that they did this. So I think it's very important that we have that expectation as parents, but it's really important to set an expectation and make sure your child understands that and prepare them for how things will be different. And these are the kinds of things that are going to be different. There will likely be daily screening for illness and changes as far as how kids are dropped off or how they're picked up for programs to promote social distancing. masks are going to need to be worn. Certainly all the adults, children over 2 will likely be required to wear masks for any interaction where they're closer than 6 feet with other program participants. And so I've been telling my patients in the office, if you've been in, you know that it's a good idea to start practicing mask wearing now if your child hasn't done that yet. Also, there are going to be changes that are designed to limit how close kids can get physically to one another. So there'll be all sorts of indicators, additional adults maybe monitoring this, and maybe just redesign of the physical spaces that they're in, whether it's daycare or summer camp. So there will need to be fewer children together. They'll probably stick with the same small group over time, a limited number of staff per small group. And so I think the best thing to do is understand that it will be different, decide if that's something you want for your child and for yourselves as a family. And then if you're considering a summer program, you have to do sort of a risk-benefit analysis, and maybe be your 2 parents who are going back to work, and this is a better option for your child to be in one of these programs, especially to get outdoors after the long winter. But I'm going to encourage people to consult with their own pediatrician, their own PediaTrust doctor. That's the individual who knows your child best, your family best, understands your family's health history and what this means to your family, and make that decision in a shared way with your pediatrician. And this can be done through a phone conversation, a phone meeting with your pediatrician. We have a great telemedicine tool in PediaTrust called Anytime Pediatrics. It could make for a great telemedicine visit, just to take the time to have that face-to-face conversation with your pediatrician. So for people who are looking for more details on this, I would refer you to the CDC. The CDC on their website have guidelines for what's required for daycares, summer camps, schools, and so on to reopen, youth sports. And you can look at some of their diagrams to give you an idea of what you should be expecting of those programs. Thank you.
Thanks, Sue. Very sage advice. So a little closer to home, we've had some other questions about what the loosening of these restrictions means in our office. So this next set of questions is going to go to Dr. Forsey. Specifically, people had questions about, is it safe to bring my child into the office for the summer physical? Is it safe to bring my child in for vaccinations? Kim, can you address some of those concerns of our parents?
Sure. We are actually very much encouraging you to come into our office to stay up to date on your physicals and shots and just your well visits in general. So what we have done for you is we have separated most of our offices into a well and a sick time of the day, and or some of the offices are only seeing sick visits and some of the offices are only seeing well visits. With that said, we are also taking temperatures for our employees and our doctors as well. We are all masked. We are asking that you only come in with 1 parent and your child to keep up with the social distancing. And of course, you will have the screening questions asked to you as well. But we are highly encouraging, especially well visits. Our waiting rooms look a little bit different than they did before. There's little stickers on the ground that keeps you waiting from the next person about 6 feet away. But the way we have people scheduled is there's barely anybody in the waiting rooms at the same time. We do have check-in by phone available as well if people don't want to be waiting, or sometimes you sit in the hallway. We are recommending everybody have vaccines, and so we are recommending all the patients come in for their 1 month, 2 month, 4 months, 6 months, 12 months, 1 year visits, especially, and all the high school visits, 6th grade visits as well. It's extremely important to keep up with vaccines in this era. As we know, vaccines are very helpful to us, and if there's one that comes out for COVID, I'm hoping that everybody will get that one as well. But for now, keep up with all of your visits. You can also do telemedicine visits for well visits if you'd like. We have a 2-step process for doing that, where we'll do most of it on a telemedicine visit, and then we will have you make an appointment to come in and give shots. And sometimes those shots can be given in the car if people are uneasy coming into the office, or we listen to your heart and lungs and things that we cannot do in person on the telemedicine. the High School Association is highly recommending that we keep up with sports physicals as well, and that if you do a telemedicine on a sports physical, that you have the well part, or the physical in-person part of that physical, done within 60 days of actually doing the telemedicine visit. And those sports physicals are actually very important for children who are in all these sports in high school and in middle school as well.
Thanks, Kim. All right. Now, over the next few months, there's a lot that we don't know what's going to happen. Nobody can predict the future. But one thing we do know is that this coronavirus is not going to just go away anytime in the next few months. It will be around. And so there's many people worried about a secondary wave of infection as the states loosen up, not only Illinois, but the states around us. So Dr. Liber, this question is going to go to you. Can you tell us what are the signs or symptoms that a child may exhibit when they have a COVID infection? And does that differ significantly from how adults respond to the infection? Pete, you should unmute yourself.
Thank you. About 3 to 14 days after an exposure, a child may develop COVID symptoms, and they're very similar to the symptoms of seasonal influenza. Your child may develop a cough, fever. Your child might have shortness of breath, runny nose, nasal congestion. Fatigue may set in. Your child may exhibit muscle aches and pains. Decreased appetite and diarrhea can be seen as well. Additionally, older children may report a complete loss of the sense of smell and taste. In pediatric patients, there's a lot more GI symptoms, a lot more gastric symptoms than there are in adults. In a recovery phase, there have been reports of varied rashes, and if you have a concern about your child having a rash that may be related to the coronavirus, I would recommend you speak to your pediatrician. The risk factor, the biggest risk factor that we found recently is that if there's a positive adult in the house, in a household, that is the biggest risk factor for a child. In different studies, 80 to 95% of the positive children additionally had an adult who was either positive or a person under investigation for the coronavirus illness. So it's the adults bringing it home to the kids, and that's an important thing to keep in mind. But the most important take-home message is that kids just don't get seriously ill with this illness. 98 to 99% of all the children who have been positive have had mild symptoms. 1 to 2% have had severe symptoms. And the children with severe symptoms tend to be heavily weighted in with comorbidities. The children who primarily are immunosuppressed, they're under, they may have one cancer or another, they may be getting medication that suppresses their immunity. That is a comorbidity that is very important in the resulting severity of illness. Children with complex illnesses, children with who are tracheostomy dependent, ventilator dependent, also are at higher risk than the other children. There are also, extreme obesity can be a risk factor, as well as severe chronic lung disease, severe asthma, and diabetes as well. In general, deaths are extremely rare in pediatric patients. And in general, the older children tend to be more susceptible than the younger children to the coronavirus. That's kind of basically it.
Thanks, Pete. You know, as a follow-up to that, you know, we've heard a lot about the comorbidities in adults. Specifically, diabetes has been mentioned as a indicator of poor prognosis for adults who get COVID. We have a lot of special needs kids in our practices, and we had several questions from parents who have special needs kids. Asthma was specifically one that was mentioned, and diabetes. Dr. Minster, can you tell our parents what the relationship is between the comorbidities that we see in adults and COVID, and is there a similar relationship between those comorbidities, specifically diabetes and asthma, with the children that get COVID?
Sure, of course, and no problem, Ruben, and thanks. Hi, everybody. It's nice to see a lot of familiar names out there. Well, yeah, we can start right away. So we got to remember, for the most part, diabetes in kids is very different from diabetes in adults. Diabetes in kids is almost exclusively type 1 diabetes. These are kids on insulin. Diabetes in adults, most of the complications that we're seeing with COVID and coronavirus is with type 2 diabetes. So this is more of an insulin resistance type picture. And especially with adults, there's other problems. There's heart problems and blood pressure problems and cholesterol problems and liver problems. Those are really the adults that are having problems with coronavirus. Those are the ones that are getting the sickest. A type 1 diabetic that is well controlled, so your 5-year-old who has diabetes, or even your teenagers who are infamous for not being super well controlled with their blood sugars, they really have no higher risk than anyone else with coronavirus. Now, a teenager who's sneaking out and vaping all the time and smoking, that's a big no-no, but you know, I'm sure we have none of those in our practice, which is always great. But it's really more about lung function, which then segues into the whole asthma question that like Dr. Liber was talking about. So diabetes in adults is really a different picture. That's type 2 diabetes, that's many different blood pressure, other things. And even if you do have a patient or your child has a insulin resistance picture or a type 2 diabetes pictures, they tend not to have the high blood pressure and all the other problems that are associated. So they're not really in any extra danger of getting super, super sick with coronavirus. When it comes to something like asthma, and Dr. Liber did mention, you know, severe asthmatics. I think what he was thinking of were the really super bad asthmatics who are in the hospital multiple times a year, or on high dose steroids, different rounds of oral steroids all the time. If your child does have asthma, uncontrolled asthma, poorly controlled asthma is not good. Because if you do get coronavirus, being a primarily respiratory type disease, yeah, your child's going to start wheezing. And so they're not going to get necessarily sicker with coronavirus, but they're going to have coronavirus and then they're going to have big asthma attacks all at the same time, exactly like influenza. You don't want your child to be sick with the flu and be trying to fight asthma at the same time. So it's really important to do good asthma control with your child. If they're supposed to be on a daily inhaled steroid, make sure they're taking their daily inhaled steroid. If you're supposed to be doing good allergy control in your house with air filters or washing the sheets or keeping the cat out of the bedroom, please make sure you guys are doing that. If you have questions, if you don't know if you're managing your asthma correctly, like Dr. Forsey said, give us a call, bring them in. We can do asthma visits virtually very, very easily. We can very safely arrange for a time for you guys to come in the office. We can do asthma control tests over the phone and in the office as well. So you really just got to, you know, control your child's asthma, and your child really won't be at any higher risk, which is really the good thing. And as you know, has been said, I think several times already, you know, coronavirus is not really even or COVID, I should say, it's not really a primary pediatric thing. Kids who are getting this aren't even getting that sick. But we all have to take, you know, good steps.
Thanks. And I just want to go back to what Pete had said earlier in response to, you know, what symptoms kids have and how few of them get it, how few of them get very serious illness. And that reinforces what Dr. Forsey was saying earlier, that our offices are actually very, very safe. Of all of the healthcare facilities that one could visit, honestly, a pediatrician's office is probably the safest place to be in terms of catching COVID, because very few kids have it. The kids who do aren't coming into our office. They're very mild. They're staying home, and we're managing them through virtual visits, telemedicine. So our offices are actually very, very safe. That doesn't mean we're not doing all the things that are required: universal masking, cleaning the rooms after each visit, so on and so forth. But all told, our offices are actually very safe. All right. Now, we've just talked about how the disease is fairly mild in children and not very prevalent. However, I'm sure many of you have heard about the worrisome syndrome, now known as MIS-C, or multisystem inflammatory syndrome of childhood. This is a very, very rare syndrome, but one that can be very scary. We had a lot of questions about this. And to address those concerns, specifically, as one parent put it, how worried should I be about this? I'm going to ask Dr. Forsey to talk about that. Kim?
So some of the parents were referring to this as a pediatric multi-system inflammatory syndrome. In the literature that we read, it's considered what's called a MIS, or miscellaneous, M-I-S-C, very easy to remember. It's a multi-system inflammatory syndrome of children. It is real, but it is extremely rare. Back in April, they were noticing in the United Kingdom that children were presenting with a Kawasaki-like illness. They were coming down with a rash, high fevers, very red eyes. So they were noticing that a lot. And that was at the end of April, the United Kingdom came down with that. And then all of a sudden in New York, they were seeing the same sort of symptoms. So in middle to April to the beginning of May, they noticed quite a few of these children, babies, very few babies. So in the scope of things is very, very, very few children. What they think it might be is that some people genetically or somehow are responding to COVID in a high, they have a lot of inflammatory reaction in their body. And this is happening 3 to 6 weeks after they've been either tested positive for COVID or they have an antibody to COVID, or they have realized that someone in their family had COVID and the children did not show any symptoms at all. So that in and of itself, yeah, I might, say, oh, okay. But these children are extremely sick children. So if these children come in with 1 day of fever, and then all of a sudden they get very, very, very sick and they don't look right to you, you need to call us. They could have several days of fever. They could have rashes. Lab tests would be done on these children. It would show that they have really high inflammatory markers in their bodies. These are some things that we test for when we look at these children. But they don't know the risk factors for this yet. They don't know exactly why some children get this and why some children don't. And like in Kawasaki, children under 5 are mostly affected. With this syndrome, the older children are mostly affected, is what they are telling us. There is no known sequelae yet to anything in COVID or anything from the miscellaneous syndrome, I call it. They don't know a clinical cure yet. It's just supportive therapy at this time. They don't know the pathogenesis quite yet. It is very similar to what happens in adults. I think people have heard what's called the cytokine storm, but they're not, like I said, everything is so new at this time. Does anybody have any questions on that?
So there was a question that came up in the chat about possible heart problems later on as a long-term sequela from COVID in children. Can you address that?
Yes, so in Kawasaki, it's well known that children can have aneurysms from the inflammation that happens in their arteries. It is not known yet what happens in this illness to the heart, to the system from COVID, unfortunately. And every single day we open up our emails and there's something new for us all to learn. And we will be glad to let you know as soon as we know what the effects are of all these things on all of our little ones. For right now, just remember that it's a very real illness or very real complication. It usually happens later on, but really know that it's very rare, and you're always welcome to give us a call at any point in time with any questions about this. But right now we do not know of any permanent sequelae from it.
Thanks, Kim. There was a question I'm going to address right now that came up on the chat that Sue has responded to, but there's a lot of people on the phone, so I want to verbally say that. The question was, have we seen any of these cases in any of our offices? And the answer is no, we have not. And in fact, as Sue pointed out, there have been no cases even seen at a tertiary care center, a regional, and even a national hospital like Lurie's has not seen any cases so far, or last we heard. So it is extremely rare, and hopefully that reassures everybody. There was several questions dealing with a specific issue that I want to address in the chat, but again, because so many people are listening by phone and not able to see the responses, I'd like Dr. Sirota to address the question, which she answered very well in the chat, and that is, what do you do with a newborn who's coming home? How do you incorporate grandparents into the house to help? Obviously, the infant's not going to be able to wear a mask. Should the grandparents wear a mask? Can anybody hold the baby? Sue, can you give us a few pieces of advice in that situation?
Sure. I think one of the most important things to point out, and this plays into almost every question I've seen in the chat and I'm trying to answer, is that because we are moving into phase 3 does not mean that this virus is any less contagious or any less likely to spread. What it really means is that because we sheltered in place in Illinois for 2 months, we did a very good job at reducing the rate of increase in disease. So we were able to achieve what we wanted to, what everyone heard about, flattening the curve. And that was so important so that the health system wasn't overwhelmed and our hospitals could take care of those people who needed the hospital. So, we're moving to a situation where we're not seeing a significant increase like we were a month ago and 2 months ago, and we're past a surge and we've leveled off and we're decreasing a bit. We need to be sure that continues so that a lot of what we've been doing really can't change. So phase 3 still involves things like face covering, social distancing if your face is not covered, limited gatherings. I already talked about how there would be very specific guidelines for programs that kids would have. So a child under a year of age is potentially at risk for hospitalization. So children under a year of age who get COVID do end up hospitalized. They can end up more ill. It's just that most of them recover and they leave the hospital and they're fine. So for a young infant, it would not be advised to expose that infant to a number of individuals. And it really wouldn't be advised to have many people having direct contact with that infant. Grandparents are important. Grandparents want to see their grandchildren. And so what we have to do is come up with a plan whereby if it's important for grandparents to see that child, that we do it in a way that's safe. And the way that's safe is going to look a lot like what many of us were already doing the past month, and that is trying to have some relative quarantine among those individuals who want to have direct contact with that child. Having a mask on and coming into the home may be okay for a limited number of adults, like a few grandparents, well, 3, 4, 6, however many grandparents there are, you'd have to make a decision as a family. But it doesn't mean that every relative, aunt, uncle, and so on, good friend, should be coming in the house with a mask to take care of that infant, because that does increase the risk of exposure perhaps to the adults in the household, and then that makes it difficult for them, if they're infected, to take care of the infant. So we still have to be very cautious. We have to have an abundance of caution, be smart about how we do things. We're able to get out of our house a little more and have maybe a bit of comfort if everyone is kind of following the rules and wearing their masks, but we shouldn't assume that everyone will do that. So again, these are decisions that are so important to speak directly with your physician. I think, and I think my partners here in PediaTrust would agree, and my partners in Pediatric Partners, is that we all as pediatricians are cautiously optimistic. We want to give it a little time and see what happens to kids once we're in this phase 3 and people are out and about more, because we went from understanding that this disease was in the community and that it could spread throughout the community to very quickly sheltering in place. And because of that, we had not yet gotten to see the impact on children and young children. Our hope is that it will be like it's been in countries that are a little ahead of us. Children continue to represent only 1 to 2% of all the cases worldwide, but we do not know what's going to happen locally. So I know that's not a very specific answer, just like you like to be told exactly what you should be doing as parents to keep your child safe. We wish we had the answers too, but we're learning to practice medicine at a time where we don't have all the answers. And we're used to having many more answers with good evidence than we have right now for COVID-19.
Thanks, Sue. All right, Dr. Liber, this next question is going to come to you, and it's a very specific question, but one I think really needs to be answered. One of our parents wrote in earlier and wanted to know, does this pandemic make my child's immune system weaker or more vulnerable? How can you answer that question for her?
First, I have to unmute before I answer that question. So the immune system, our immune system needs to be exposed to different illnesses to develop natural protection against it. With the shelter in place that's been going on for the past 2.5 months, many of our children have not been exposed to some of the routine colds and other viruses that have been in the community. So in that regard, there's a pause in the maturation of our children's immune systems. In and of itself, the COVID infection does not weaken the immune system. The isolation can, I wouldn't say weaken it, but it would lessen the chance of developing natural protection against some of the common illnesses that aren't seen because of the shelter-in-place strategies that people have taken. So, and dovetailing that with vaccines, basically, any vaccine functions to fool the immune system, the body's immune system, into thinking that there was an infection and producing natural antibodies against it, so that if that illness is encountered, the body will fight it and that person does not succumb to that illness. So in some ways, it's a pause in the maturation of everyone's immune system by doing so. So.
Thanks. As a follow-up to that, I would want to point out, as pediatricians, we've all seen, as parents, I'm sure you've all seen, that not going to school and socially isolating, as Dr. Liber pointed out, means that over the last few months, our kids have been pretty healthy. And as the state loosens up and children and adults are now socially getting together a little bit more, we may see a spike in common, routine, benign illnesses, colds, stomach viruses, things of that nature. So just be prepared for that. We see that commonly every year in the fall when school goes back in session. Even though school is out of session, we are going to be going from very socially isolating to not. And so you may see in your children or in other members of your family that some of these common illnesses are a little more common during the summer months than usual. So just keep that in mind. There were several questions that were sent to us by parents regarding testing. Testing not only of children for COVID, but antibody testing to see if they had it, and testing our staff members to see who's had it. for those concerns, I'm going to send those questions over to Dr. Minster. Riley, can you answer some of those questions for us?
Yeah, for sure. So yeah, testing, there are two types of tests out there. So there are the antigen tests, and those are the nose swabs. And those are the tests that say, yeah, do I have COVID or do I have coronavirus now? Those are what the big drive-throughs have been on for the past couple months and stuff like that. And for the most part, those are very good tests if done correctly. So a lot of those are nasopharyngeal swabs. So that doesn't mean they swab the outside of your nose. That means they go super, super deep. And adults don't like those. You can imagine the kids, 3-year-olds really don't like those. But they're good tests. They're very, very accurate. They're DNA-based type tests. And the results come back rather quickly. And they'll tell you, do you have coronavirus or not? Most hospitals, major laboratories, LabCorp, Quest, et cetera, have very good tests that are out there. Obviously, if you're not having symptoms and you haven't been sick for a few days, those tests aren't going to do you any good. I would not go ahead and buy tests off the internet. I wouldn't buy, any blood test that tells you, do you have coronavirus now or anything like that, because just the technology is wrong and not reliable. What I think most questions are about nowadays are the antibody tests. So this is the thing that I'm answering on a daily basis. Those are the IgG tests, which are blood tests, and they go ahead and they tell you, were you ever exposed to coronavirus or did you have coronavirus? And those seem to be a little bit more, I guess, popular, for lack of a better term right now, because everyone and their brother want to know, did I have coronavirus? Every single day I hear a story, oh, I was really sick back in February and I didn't have the flu, I was tested negative for that, and I really want to know, did my kid have coronavirus? And so those tests, like the antigen tests, those are good tests. They're pretty accurate. You have to take everything with a little bit of grain of salt because nothing is 100% accurate. There is possibility, a very small percentage, that there might be some cross-reactivity. So if you do get a blood test and it shows that you do have a positive IgG, that means you probably were exposed to coronavirus, meaning that you have antibodies to the circulating virus, to COVID-19. There might be some cross-reactivity depending on how great of a test that is to some other coronaviruses. So you always have to kind of keep that in the back of your mind. But more importantly, you have to kind of step back and say, what is this information going to do for me? And that's really the big thing. Because just knowing that you had it in the past, or your child had it in the past, how is that going to affect your daily life? Because we don't know anything yet about immunity. So even if you have a positive IgG to COVID-19, that doesn't mean that you can stop social distancing. You still have to wash your hands all the time. You still have to wear a mask. You still have to be smart about this. And that's kind of really, the message that we're sending to our patients, and that I'd like to send to all of you, is that there are good tests out there. I think in the future, we're going to see more and more testing. Just so everyone on the phone and online knows right now, we have the ability to start expanding our testing within PediaTrust within the next few weeks to next couple months. So certainly we're going to have the ability to do both types of tests in our offices, because we do think that that's important as the disease kind of progresses, and the economy and society does start opening up. These tests are going to mean more things, especially when we learn more about immunity. There are some very early reports right now about immunity, so meaning, does having a positive IgG confer immunity? And right now, the very preliminary report saying, looks like maybe, or not maybe, I should say, that having a positive IgG probably confers some immunity, but no one knows really what that means or for how long or what degree of immunity. And if you think about it, that's kind of how vaccines work. So that's encouraging news for sure. But right now, we do not encourage getting IgG tests for everyone because we don't want to kind of, create two classes of people here. We don't want to have, we don't want to treat whole families of careless people that are going around and not wearing masks and being irresponsible And then those people who thought they had the virus, they spend a lot of money, use a lot of healthcare dollars, use up tests that could be used for people that really do need these tests. And then they go ahead and get tested, and then they find out they don't have the antibodies. So you got to really think, like, what's this information going to give to me? So as I said, there are very good tests out there. They're improving the tests all the time. They're constantly, reanalyzing the data. And we hope to be able to use these tests, certainly as part of private practices, as some of the earliest ones available.
Thanks, Riley. So 2 questions. One came in on the chat that I'll address very quickly, and that is if your child is sick and symptoms consistent with COVID, is there a test to be done right away? And our response will be the same thing that we've been saying for the last 2 months, and that is that it all depends. If the child is very mildly ill, there's often no reason to get a test. So if you're unsure, the first thing to do is to contact the office, either by phone or through MyChart. A telemedicine visit might be a way to figure out if a test is needed or not. And hopefully in the next couple of weeks, we should be able to have some testing available for acute cases in most of our offices. The second question came in on Facebook, Riley, and that is there a specific age for which you might be testing for antibodies? Teenagers, young kids, what's your response to that?
Is there a specific age that I would test for?
Correct.
No. I mean, the answer is the same. I mean, obviously I wouldn't be testing any babies. Babies have their mom's antibodies. They don't have really their own antibodies immediately. But no, I would not use antibodies testing right now as permission or risk assessment. Like, oh, I'm going to send my child off to college, so adolescents. So I'm going to see if they have antibodies, and if they have antibodies, they can go to college, and if they don't, they can't. I mean, we're not making medical decisions like that. All kids develop antibodies well, just like adults do. I mean, little kids have a little bit better immune system, so they respond to vaccines differently than adults. But that's not what we're talking about here. So age doesn't matter.
Right. Thanks. So we've been getting a lot of questions on the chat and through Facebook about some of the social implications of loosening up the restrictions. And specifically as it relates to teens, it's very hard to get teens to obey rules, as we all know, those of us who have teens in our house. Many teens are not paying attention to the social distancing rules that are still in effect, even though we are loosening restrictions. So we've been getting a lot of questions about that. Again, I'm going to turn to Dr. Sirota. Can you give us some guidelines about how to get teens to socially distance and wear a mask and do all the things that we still want them to do?
So, I guess I would start by saying, I understand why so many parents are asking about this, and I'm a parent of teen. I have 2 who are just past teens, and I have a teen. And this pandemic, if we look at all the different developmental stages of childhood and adolescence, this has been most difficult for teens. It is a time where they're about developing a social identity, and here we have kept them from school. I mean, everyone who has a teen at home knows that their teen probably said for the first time in their life they want to go to school when they were home and shelter in place. So we've really had 2 months of a lot of isolation, social restriction for most, and it's been very hard for them. And we understand that, and I understand that as a parent and pediatrician when I give this advice. But what is not okay is to allow our teens not to follow the guidelines when they socialize that have been established to move into this phase. So I'm going to really repeat, I said already what those are, but we need to maintain social distance, which is 6 feet or more. And if we're in situations where we can't, like there are a couple beaches in local towns in my area where I practice that have opened up, then masks need to be worn and gatherings or groups of individuals need to be limited. And I think it's very important, the hard work of parenting is enforcing rules that are important for the health and safety of your child, whether other people's kids are following the rules or not. And that's what I'm going to recommend is, you know, a family meeting might need to happen this week with Friday coming. It's right around the corner. Everybody should be home at this point, and talk about what this means for your family and what your teens are allowed to do and what they aren't allowed to do. I'm sure many of you as parents are seeing photos already from this past weekend on Instagram or Snapchats if your kids show you. And there are a lot of people not following this. So what do you do as a parent if your child wants to be with their friends and they're not? I would pick an analogy of anything else. If health and safety is your family value and you expect your family to follow this, then it's no different than what do you do if you see your kid's friends vaping on an Instagram photo or drinking alcohol underage or something else. Do you permit your child to be with them when you know they're doing something that's unsafe? Or do you talk about your expectation for your child and why you don't want them with that? And I think that's very difficult. It's difficult advice to give. It's difficult advice to practice as a parent, but I think it's important. And if we take the approach of, oh, what am I going to do? All their friends are doing this too. I might as well just let them. We will be right back where we were potentially, you know, a month ago and 2 months ago, because not following these guidelines will not allow us to stay in this recovery phase, and more important, move on to the next phase, phase 4, which is really going to allow school to open up for kids. Because to get to that phase, we have to have no increase overall in hospital admissions for 28 days. We can't get there with everyone hanging out at the beach together in large groups or in large parties without masks.
All right, thank you for that, Sue. So we had another question that came through on Facebook, and I'm going to send this one to Dr. Liber. If a mother had COVID and was tested, came back, and dad had an antibody test that came back positive, should the kids be tested too? What do you think about that scenario, Dr. Liber?
Well, testing is a good idea if it changes what we do. If it can positively affect the care given to the child, then a test may be indicated. If a child is not symptomatic, not ill, there's no good reason to do a COVID antigen test or a COVID antibody test as well. For the reasons that Dr. Riley outlined earlier. So we treat the patient in real time and we order tests accordingly. So that would be my answer to that question. And every situation is a little bit different. So that's why good communication with your pediatrician is important.
Dr. Rucoba, you need to unmute.
Thank you. Sorry. There have been a lot of questions about the mental health of children and adults over the last few months while we've been socially isolated. So for this next question, I'd like to turn to Dr. Forsey. What can you tell us, Kim, about how the pandemic has been affecting children's mental health in general? And specifically, there was a question from a parent about what do we do or how do we handle a child who may be frightened by people wearing masks?
Well, definitely COVID has pretty much rocked our world, I would say, in all age levels. Nothing is the same, nor will it be, probably for a very long time. So children with masks, we'll address that one first. I think what we need to all do is show the children that we are all wearing the masks and get them cute masks and show the parents and have the parents wear masks and have the grandparents wear masks. And so the child does not feel like he's the only one wearing a mask. There are ways we can make the masks comfortable for the children. There are very cute little neck guards that go on the back that keep them on their ears. if everybody's wearing one, they will most likely get used to it. Children are very resilient, and they learn fast, especially from good teachers like their parents or their older siblings. Some things you want to keep an eye out for in children, especially little kids, are change in their sleep pattern, stomach aches, headaches, not wanting to go outside because for fear that the outside, since now we've been at home for such a long time, that the outside has cooties or they're going to get it from the wind. Or so let them know by wearing a mask, they will protect themselves from this cootie that's out there or this virus that we're speaking of. And kids at this age, the little kids have lots of questions. So answer their questions, try to relieve their anxiety a little bit, and be open with them, but definitely set an example for them as well. Now, then you have the middle-aged kids who they just want to be with their friends, but some of them are also going through some developmental changes themselves where, middle school children, they might not want to be with their friends. And they might be enjoying this stay at home right now. But what you need to look for is a change in their behavior or a change in what they want to do. So if a child is loving to play video games most of the time, and he's been playing a lot of video games right now because he's in COVID or in, stay-at-home orders, but all of a sudden he doesn't want, or she, excuse me, does not want to play those video games anymore. That's when you need to be worried, when a regular activity has changed. And then in some of the teenagers, who wants to be stuck with your parents at home being a teenager? That's the last place they want to be, really. So with the teenagers, look for anger. Anger is a very big sign of depression in teenagers. They might say, "Oh no, I don't care," but they lash out and they're very angry and their demeanor changes. So you want to look out for very, very subtle signs in some of these children. We have had a few cases of suicide in the area recently. I know of one child that actually overdosed, and he did have COVID on autopsy, but it wasn't because of the COVID. But there's something, we do have help out there for these children. We can do telemedicine visits for mental health in our offices. So please call us, make an appointment. We have a psychologist that works at Pediatric Partners in Vernon Hills with Susan Sirota's office, and she's fabulous. I've sent quite a few of my patients there, and they really do help just to talk to somebody. But don't worry about coming into the office, because these are really good appointments to be made on telemedicine visits. And we're very happy to talk to you or your children, or just see their faces, to stick you out of the room and just talk to them by themselves. But just look for change, and look for change in what they used to like to do. So someone's having potty accidents, I'm reading online here, during the day. You know what, I have heard of potty accidents as a change in something because they're scared or they're nervous. But you really want to make sure with potty accidents that it's not a UTI. Children are running around all day, and some people aren't changing their clothes as often because they're at home, or they might not be keeping as many showers. And so you want to make sure that those potty accidents, number one, are not a urinary tract infection and not just a behavioral, first off.
Thanks, Dr. Forsey.
I would just add, and thank you for those answers, that the psychologists who are integrated into PediaTrust, they are all doing telehealth visits as well. So those can be done from the safety at home. And in the case of teens, a lot of times they like having the privacy of home for those visits.
Thank you, Susan, for that reminder. So we had a very specific question that I'm going to address to Dr. Liber that came in on Facebook. Should I be putting off taking my child to the dentist for a routine cleaning? Is that too high of a risk since her mouth won't be covered? What advice can you give that parent?
Well, we all know that recently the dental offices opened up to more routine care from exclusively emergency care. And I would answer that question in the same manner that I would answer should my child come into the pediatric office for routine well care. I would say yes, you should double check with your dentist to make sure all the precautions are in place to protect your the health of your child. The dental offices should be at the forefront of personal protective equipment, and the risk of, in a proper environment, the risk should be relatively low. As with everything, it's a risk-reward analysis. Routine cleanings often detect problems, small problems, before they become big ones. So I would definitely talk to your dentist about that, but I would give a cautious green light to that answer.
Thanks, Pete. So I'm going to send this next question over to Dr. Minster. We've been getting lots of questions on the Facebook side, as well as a few in the chat, about daycare situations. I know we touched on that subject earlier, but we're still getting a lot of questions. So both an institutional daycare and about an in-home nanny. What is the advice that you can give parents, Dr. Minster?
I assume, Ruben, that you mean just returning the daycare, or just how safe is daycare?
Correct. And we get a lot of questions about if my child is sick with cold symptoms, are they going to need a test for COVID? Because is the daycare going to want to know? Is it safe to go to daycare? Is it safe to have a nanny come in if it's the same nanny? Those types of issues.
Right. So I want to, first of all, reference what Dr. Sirota said way at the beginning of this talk, is that you really have to kind of take stock into what's going to be best for your family right now. Things have to be different. This is, we are in coronavirus land for the next few months until we have great tests, a vaccine, and great medicines. So it's gonna be a year minimum. So things have to be different. If your family needs your children to go back to school, go back to daycare, they're going to look a little bit different. They're going to be groups of fewer kids. I would assume that most caregivers are going to be wearing masks. There's going to be a lot more hand washing, as if there wasn't already a ton of hand washing. And I think in those regards, with those control measures in place, I think it's very safe to go back to daycare. Again, remember, coronavirus in kids it's not really a big disease burden in kids. It's more of like, if you guys have to get back to work, or if you need your kids, to be social. I almost said to be socialized. If kids need to go back into daycare or preschool or regular school, by all means, if this is what works for your family and for your family unit and your own mental and emotional well-being, I think it's very, very safe. The risk is more, they might catch something there from another parent and bring it home, and then you yourself might get sick. So when your kid comes home, maybe you do some hand washing, you change clothes, little things like that, even though there's really little or to zero transmission of this virus from surfaces and clothes to people. Really, it just, it was a theoretical thing at the beginning, but it really doesn't happen. When it comes to colds, and just daycare, little kids, especially toddlers, get 5 to 10 colds a year. I mean, that's what happens. They get sick all the time. And so it's going to be difficult to tell what is a cold and what might be coronavirus. If you're worried, that's when you make an appointment, you make a virtual visit, or you can bring your child in. If your child is super, super sick, of course we're going to want you to call. We're going to want to take the extra precautions of getting your child seen safely. And we're going to want to make sure that we have the ability to do coronavirus testing in our offices if it's warranted. All right. And that's really the key is every parent is going to want to have their kid tested for coronavirus every time they get a sniffle the first week they go back to daycare. But that's really not the case. Even Lurie Children's Hospital has done 4,000 coronavirus tests, 4,000 active coronavirus tests on kids with symptoms. And they found less than 10% of those kids who they thought had coronavirus were actually positive. So this is really not a virus that really causes a lot of disease burden in kids. Most likely your kid has one of 100 other viruses, or an ear infection, or influenza, or enterovirus, now that we're heading into the summertime stuff. So, when kids start coming back, they're going to be sick. But I do think it's very safe to get your nanny working again, to try to resume some kind of normalcy with changes that Dr. Sirota alluded to earlier.
And I
thanks, Dr. Minster. And I'm going to send this back to Susan. You have a follow-up to that.
Yeah, and I wanted to add for reassurance for families that in my own practice, I have several families who have been sending their children to daycare throughout this entire time in shelter in place, because they are two-parent working families where both parents are essential workers. And I hope it would be reassuring for people to know that, and this is even before the CDC published guidelines came out 2 weeks ago, that these children who have continued to go to daycare have not been sick with COVID-19. So I just want to reiterate, not only are we talking about answers to questions where we're not sure, but we do have 2 months of information about children who have been going to daycare because they needed to, and they have been fine. They have not had COVID-19. So I want to give really a decent amount of reassurance to parents who are looking at going back to work next week, and they do need to have a place for their child to be safely cared for. So I just wanted to add that.
Thank you. Well, I fibbed a little bit earlier when I said that we were going to get to some general pediatric questions, and we didn't really get to any of them, but there was a lot of questions that came in on the chat and through Facebook about COVID. We wanted to address those questions live, and hopefully we answered most of those. It's been an hour. We're going to wrap up now. I want to thank all of you for joining us. We are going to be doing more of these sessions in the future, and very soon we're going to be having one, hopefully in the next month or so. Much of that session will be devoted to pregnant women and newborns being born during this time of COVID. There was a couple of questions about that today, and I know we get a lot of questions about that. So that'll be the focus of our next session. And be sure to look on our website and our social media accounts, Facebook and Instagram, for an announcement about when that might occur. We'll probably have a few other panelists at that time, and perhaps even an obstetrician if we can partner with one. But I'd like to thank our panelists tonight, Dr. Forsey, Dr. Sirota, Dr. Minster, Dr. Liber. Thank you for answering all of these questions. I'd also like to thank those behind the scenes that you folks out there can't see who made this event possible. Couldn't have done it without them. Lizzie Young and Angelica Cha, thank you very much. And good night to everyone. And look to our website and our Facebook accounts for an announcement about our next session. Thanks so much.
Everyone, have a good night. Thank you.
Bye.